welcome to my channel. My name is Cindy. I'm a mom and a public health specialist. Today we are going to talk about breastfeeding. We are going to address some of the misconceptions around it, and also while we're addressing it, I'm going to drop some tips that would help you to have a successful breastfeeding experience. So let's go right in. The first misconception is that breastfeeding is painful, and that is not true. I said it. Yes. Breastfeeding does not have to be painful if you do the right things. Yes. Most moms make this mistake, and at the beginning or towards in the middle of their breastfeeding, they have pains, and when there is pain, it makes breastfeeding to not be a pleasant experience. It makes some moms to even stop entirely. So what I do here is that even before my baby comes, I start to prepare my breast to breastfeed that baby. Yes. What I do is I get a cotton wool, I dip it in olive oil, and I use it to clean around my breast, around the nipple and the areola. I do that twice a week until the 36th week of my pregnancy. Around the 36th week, I would reduce it to once a week. I would just do it once, and that's it. When you do that, I noticed that you don't have those early stage sore and cracked nipple. I had this sore nipple with my first child, and by the second time I tried to find out what to do to avoid that. And that was when I came across this experience. I don't know the science behind it, but trust me, I know it works, and most moms would swear by it. When you do that, you would not experience those early stage pains when breastfeeding, when your baby starts, sucking on those breasts. Now, another thing that would make your breastfeeding experience painful is when your baby does not latch well. Yes, when your baby does not hold on to the breast the way he should and suck on it the way he should, it would make those breasts to become painful, to become sore. What you should do, or what I do rather, is that when I want to breastfeed my baby, I put the breast close to his mouth, and when he senses the breast is there, normally he opens the mouth. And when the baby opens the mouth, you put in the breast the way it should be into his mouth. The mouth is supposed to cover the areola and not just like nip on the nipple. No, it should be around the areola, and then the baby sucks on it. But if for some reason I try it the first time and it doesn't work, what I do is to put my finger by his mouth and bring out the breast and try it again until I get it right. That way there will be no pain then or afterwards, after the breastfeeding. Another thing that would make the breast painful is when it's engorged, when it's too full. Probably because of oversupply, or maybe because the baby has not sucked on it when it's supposed to. What you do is to feed your baby on the engorged breast, or if the baby is not ready to feed, you get a pump. There are cheap hand pumps, manual pumps you could use to extract some of the breast milk and to relieve the pressure on the breast and the pain. Yes. Or you could hand express. Another thing there is that sometimes the breast becomes painful because there is an infection. Yes, it could be a bacterial infection in the case of mastitis, or it could be a fungal infection in the case of thrush. So whenever your breast pain comes with rashes or redness or swelling, please, you have to see your doctor for the right treatment, because it's not the normal pain that is associated with the baby sucking on the breast anymore. There is an infection there which a medical personnel should look at. Then the second misconception there is that the size of your breast determines how much milk you supply. That is the biggest lie of the century. It is not true. Your breast milk size, the breast milk you supply, is not dependent on how big your breast is. Okay? If that is true, then some moms with very small breasts will not be able to breastfeed their babies. But I've seen mothers with very small, when I mean very small breastfeed their baby exclusively and for years very well, because it's not dependent on how big your breast is. I could remember having my third child, and for some reason I could not breastfeed him for some days after having him, for some medical reason. And by the day it was time to breastfeed him, I tried to pump. He could not suck at that moment, so I had to pump, and I tried to pump out the breast, and it was not flowing out well. I remember the nurse walking into the room and like, woman, don't tell me this your big breast is not producing milk for this baby. I was like, what? I was mad. But I think what I should have done is to pump and dump. Yes, because I was in the hospital and there was no way I could have stored it or anything. But I could have pumped and dumped so as to maintain the flow of breast milk until when the baby is ready to suck on it. But I couldn't do that because of, psychologically I wasn't ready. I was not organized to do that. So it doesn't, if you like, let your breast be so big that can feed the whole nation. Believe me, you can still have low milk supply. Milk supply is dependent on how much you feed your baby or how much you take out the milk from your breast. Okay? If you don't feed your baby frequently or you don't feed exclusively, the milk supply starts to drop. So the more you feed, the more your breast produces. And there's another thing I think is involved there. I experienced it, and I think some moms too swear by it, that when you have your baby and your baby starts to breastfeed immediately, it helps a lot. Psychologically, it attaches that baby to the breast before the baby realizes where he is in the world and everything. He's already associating himself to the breast. So it kind of makes the baby to suck more, and it helps to produce more breast milk. Because I think my first child breastfed very well. The moment I had her, she started breastfeeding almost the next 10 minutes. But my second child did not breastfeed immediately. I had a good experience with her, but it wasn't as good as this first one. And this third one that did not breastfeed for days, in fact, somehow, I don't know, psychologically, he could not click with the breasts and the breast milk. So I didn't have a good breastfeeding experience with him. Yes, I must tell you. And when I talked to his doctors, his pediatrician and lactation person that I discussed with, when I was going through the breastfeeding issues, they associated his not liking the breast milk and not feeding well on it to the fact that he was not breastfed immediately for days. Okay? And in fact, I fed him formula. You remember I said the breast milk was not coming out well. So they had to give him formula first. The first feeding was formula until I was ready, and the breast milk was ready before he was now switched back to exclusive breastfeeding. So for that reason, I don't know, it's like he never clicked with breast milk, and to the end, I didn't breastfeed him exclusively. Let's just say that I just tried exclusive breastfeeding, I think, for 3 months, and that was it. If I got to a point, it was not working. When he was aware of himself psychologically that, see, I don't like this thing, it became more of a struggle, more like force feeding, which was, the doctor said, was even worse, because there are so many issues that could come up with that. So I had to try formula to see how it works, and it worked fine. So having said that, breast milk supply is dependent on how much you feed, not on how big your breast or how small your breast is. Wow, another misconception. I know most mothers, especially our CCs, those ones that mommies like to do at home, you think that breastfeeding will change the shape and the size of your breast. So because of that, you don't want to give that baby food. You don't want to breastfeed that baby. God is watching you. Anyway, breastfeeding is not the culprit here. Yes, that is not what changes the size and the shape of your breast. So if you like, breastfeed that baby. If you like, don't breastfeed the baby. The shape of the breast will change. Yes, the shape of the breast will still change. So why won't you give that baby the goodness that flows out of your breasts. Why would you deny that baby of it? Why? Pregnancy is what changes the shape of your breasts and the size. If you notice, if you're in tune with your body, most times people realize that they might be pregnant as very early because of the changes in their breast, the feeling in their breast, the feeling they have around the breast area. Because once you get pregnant, the size and the shape of your breast starts to change. That is when the changes start. So whether you breastfeed or not, pregnancy itself changes the size and the shape of your breast. And even if that does not happen with age, that breast will still fall. Yes, if you like, let it be standing like Iroko tree. When the time comes, it will fall. Yes. So I don't see why mothers should say that breastfeeding will make my breast to fall, will change the size of my breast. I want it to be standing till I'm 80. My dear, once you clock your 30s and you're heading to your 40s, come and show me a standing breast. I will tell you that breast is not real. Yes, it is synthetic. It is not real. So with good bra, you don't have to worry about that. And even now, there's breast surgery. So what do you want to tell me? That because of the shape of your breast, the size of your breast, you won't exclusively feed your baby for 6 months, or you breastfeed that baby for 8 months, and the baby still wants to breastfeed, and there's nothing stopping you, and you say, I don't want to breastfeed anymore. But the more I do it, the more the shape of my breast will change. That is not true. Besides, breastfeeding helps protect you from so many types of cancers, like breast cancer, ovarian cancer. So why won't you take on that opportunity? If there is a 20% chance that breastfeeding your child would give you some immunity against those types of cancers, why don't you do it? So please, mothers, let us save our sissiness for later, or channel it to other areas. Okay, there is a lot of things we could do to make our breast stand. We could do some breast exercises, which we can discuss in other videos. There are good bras that could support your breasts very well, and as well there's breast augmentation now, which you could do if you feel like and if you have the resources for that. So please, let's not deny those babies. The next misconception here, of which I am a very big culprit, so go and call the police to come and arrest me immediately, is that breast milk makes you fat. Sorry, breastfeeding makes you fat. Oh my god, that is a big fat lie. Breastfeeding does not have to make you fat. In fact, breastfeeding is a fat burning machine itself. If you do it the right way, by the time you're done, you find out that you've lost weight even without exercising. Yes, breastfeeding is not the culprit here. Okay, you just have to watch what you eat. Some mothers were like, I'm breastfeeding, I have to eat, I'm hungry every 30 seconds. This baby is eating too much. I think I have to eat too. You don't have to. You can keep up your carb supply, your energy supply on good vegetables, and you'll be able to sustain yourself. Instead of snacking on all those unhealthy foods, biscuits, chin, bread, and all that, you could just try to have some vegetables on hand. Cucumber is a very good one. What I do is to have some cucumber rings. Cut up the cucumbers and keep them. You can have carrots, you can have apples, you can have as much as you can. You have 3 good meals, 3 big meals, normal meals during the day, in the morning, afternoon, and at night. And in between those meals, instead of eating again or snacking on unhealthy things, you have your fruits and your veggies around you, so that you can just have them when you feel hungry. And you drink a lot of water as well. It will help to satiate you. Because personally, I find out that once I'm breastfeeding, the moment when I'm even breastfeeding, I'm already feeling thirsty. I'm feeling the thirst coming. So I take a lot of water. And when you do that, you don't really associate breastfeeding with hunger, So please, I am a culprit, like I said, and I know most mothers are. It's not just for those who they don't want to gain weight, I don't want to gain weight. I don't want to gain weight. I want to lose weight. I want to go back to my pre-pregnancy weight. So this guy has stopped feeding. No. please breastfeed the right way, do the right thing, and that weight will come off. Before you finish your exclusive breastfeeding, the weight will come off. So another misconception is that most mothers, you think you can't get pregnant breastfeeding. Hey, I'm sorry, it's a lie. You can't get pregnant breastfeeding, especially if your menstrual cycle has returned. You can get pregnant. Yes, you can. So if your menstrual cycle has returned and you know you're not ready for that baby yet, please and please look for an alternative birth control method, because that breastfeeding is not going to work. I got pregnant with my second baby exclusively breastfeeding the first one. Yes. So, and many mothers too. I could remember after having my third baby, I've had a pregnancy scare. And when I went to get this, I was like, what? My baby was just like 3 months. It was a scare anyway. Thank God it was not pregnancy. But when I went to get the strip, a mother was right there crying. My husband will remember. She was crying. She was carrying a baby of, like I said, 4 or 5 months. It was just a few months older than my baby the day I asked her, the day we met her. The baby was actually I think 1 month and some days older than my baby. It was not up to 6 months, and the mother was exclusively breastfeeding him. And the woman was literally blowing her eyes off at the pharmacy. She was like, God, what am I gonna do? I can't believe this. But I thought when you're breastfeeding, you won't get pregnant. I was like, madam, see, the baby has come. Thank God that me and you are not in the same boat. But then I told her, I tried to console, talk to her. But she just couldn't wrap her head around the fact that she was exclusively breastfeeding, and her period just returned that same month. Like, that same month that her period returned, she got pregnant. I was like, it's possible, it's possible. Once your menstrual cycle returns, please and please and please use protection. Look for other sources of birth control. There are mothers that even before the period returns, the period never returns, because probably you've ovulated that month and the period was supposed to come around if there is no fertilization. But because you've ovulated without knowing, you get pregnant, and there will be no period, practically no period. That one is rare, but it happens. So if you know you're not ready for a baby, please look for another means of birth control, so you space your children very well. This does not just go for those who want to prevent pregnancy. Yes, some women, because of some reasons, probably age, or maybe because they had issue conceiving, and so they don't want to wait. In fact, they're ready to have another baby next minute. If you say another baby, they're ready. So they don't want anything that would disturb that trying for another baby. And they think that, if I'm breastfeeding, I can't get pregnant. No, you can. It doesn't stop you from trying for another baby. If you think you want to, you really have to. Probably you're 39 and you're like, I can't afford to wait a whole year before trying again. Come on. So you want to try immediately. Well, you don't have to stop that baby, because once your menstrual cycle returns, you're as fertile can be. Okay? Now, believe it or not, some people stop breastfeeding their baby because believe it or not, some people stop breastfeeding their baby because Oga needs it more. They want to resume their role in the other breastfeeding department. My sisters, why will you do that? Breastfeeding does not stop you from giving Oga his share. I've had friends, in fact let me not say friends, I have a friend who stopped breastfeeding because breastfeeding is like the only thing her husband connects with. And once sucking on the breast, let me not say breastfeeding before somebody's husband will come and arrest me. Sucking on the breast is what the husband connects with, and if he's not getting that, he's not okay. Yeah, it happens, and I know that is the truth for most of us out there. So you don't have to stop your baby. If a guy is getting a share of the breast milk, it's not harmful. In fact, Oga will even help you to boost your supply. Yes. Don't deny that baby of that breast milk. God is watching you. If for any reason, probably because maybe of HIV or an oral infection or maybe other medical reasons, your husband is not supposed to suck on your breast, please don't let him do that. Let him wait. The breast is not running away. Okay? Let the baby have that breast exclusively for like 6 months at least, and then Oga can resume his work in the other departments. Okay? Please don't deny that baby of that breast milk. Thank you. Okay, to wrap it up, I want to talk a bit on exclusive breastfeeding. I know the hype, I've been saying breastfeeding, but it's very good. But please, for some reasons, some mothers may not be able to exclusively breastfeed. Mothers, get this into your ears. I know the medical practitioners, some of them may come for me, but it's the truth. Because I know somebody whose baby became so lean, she will practically wrap the baby in a flannel, like you're wrapping I don't know, you're wrapping a gift or something. She won't let you see the baby when she's taking her out. She's so ashamed of presenting her baby outside, a baby of 5 months, and it's still looking so tiny and so malnourished. Woman, what is the problem? Doctor said nothing is wrong with her, that she will improve with time, she will do this, she will do that, and every day you're going to the hospital because that baby is not getting enough breast milk. And for some reason, maybe you're not producing enough. Yes, there are some reasons that will make a woman not to produce enough breast milk. Or for some reason, the baby is not just getting it. It's not just, getting enough, taking enough, or it's not just, does not just like the breast milk or the breast. Yes, it happens, believe it or not. This is mom's experience. Don't insist on breastfeeding exclusively. Hey, they say exclusive is the best. I must breastfeed this baby. It's only breast. You must not suck any other thing. And that baby is slimming and leaning down every day. Woman, fed is best. It is best your baby is fed. Instead of I don't want my baby to they say no, nothing, only breast milk. Please, if for any reason your baby, you think, mothers will have this instinct, like I had with my third baby. You have this feeling that this baby is not getting enough breast milk. This baby is not growing, as in, is not looking healthy enough the way he should be. Please go and see your doctor. I visited the doctor more than 3 times on this issue when my baby was not getting enough. From the time of his birthday, about 3 months when I stopped, I continued insisting, see, this baby is not gaining enough weight like he should, and there's nothing wrong with him. Medically, you've checked and you said everything is okay. But I think I know where the problem is coming from. He doesn't have light breast milk. I got to a point I had to pump to feed him. So he's just not getting enough. I know it. I'm his mother. I had to insist before the doctor reluctantly said, oh yeah, try formula, let's see. And believe me, from the moment I tried formula, my life was never the same. Because it gives moms a lot of stress when your baby is not feeding the way you should. Okay? So that is it. I think my baby is calling for the breast milk. Alrighty, if you have any comments, any questions, you have your own experience to share, a misconception you think is out there that I didn't mention, please share it and let us know. Thank you so much for having me. Thank you for staying on my channel. Bye-bye.